In this video, I'm going to show you how to do the classic exercise for treating your neck pain. This exercise has been around a long time. We prescribe it to a lot of people, and there's a reason for that. It works. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, and in this video, I'm going to show you how to do an exercise called cervical retraction. As I mentioned in the introduction, this is often prescribed for people who are having neck pain. It's also effective for people who are having upper trapezius or shoulder pain, pain in the shoulder blade region, or even pain that comes down in the arm. I've seen it work for all of those conditions. When doing cervical retraction, I recommend that you do the exercise sitting down, and ideally with a chair that has a straight and firm back. This won't be as effective if you're sitting on the couch or in some kind of soft chair that you kind of just fold into. If you can't do it sitting, then standing is an okay alternative, but sitting is definitely the best. The reason for that is we want our spines in an optimum posture because we're moving our heads backward into a form of extension. If you're sitting either without a supported back or in a chair that you kind of just fold into, see what happens to my posture? And my neck can't move that well. But when I'm upright, I have much more motion. Do you see that? And we tend to sit like this in our desk jobs. Sitting at work, 8 hours. Sitting at work, 8 hours. And we're trying to kind of undo that with this exercise. So you want to sit in a chair with an upright back and firm, if possible. In addition, I recommend that you use a lumbar roll because it keeps because when your low back is in an ideal posture, then everything up the chain, your mid-back and your neck and head are likely to be in a better posture as well. Here we are. Our butt is all the way back in the chair. Chair is nice and upright and firm. Use a lumbar roll if you have one. If not, roll up towel. If you don't have that, don't worry about it. Just sit in a straight back chair. Here we go. Put that in the small of the back. Pretty good posture here. What you're going to do is pick a focal point straight out in front of you. Let your eyes focus on it. Your chin is parallel to the floor. Your chin is parallel to the floor, and we just maintain that as we move our heads backward on our neck as far as we can. Rhythmical fashion with this. You hold the end point for 1 to 2 seconds. I like to use my finger as a visual cue to let me know that I am, in fact, moving my head backward and then back. The finger's also a great way to prevent you from slingshotting your head backward beyond the neutral position, right? We tend to sit like this at work, especially if we have computer jobs, and the finger can prevent us from doing that. This way. And notice, we're not doing double chin here. We're going triple chin. See that? Get these Shar-pei folds to form on your neck. That's what we want to do, end range. This way. Triple chin from this angle. Okay, see that? For most people, you're not going to be getting to end range with just doing the exercise this way. So we're going to have to add a little overpressure. We're not pushing hard. We're just doing a light amount of force to get our heads and necks farther back. So here I am. Go back as far as I can, a little overpressure. So maybe now we're getting a quadruple chin. Back, overpressure. You can do it with one hand or the other or both. It doesn't matter. You're not pushing hard. Back we go. Overpressure. Back we go. Overpressure. Do this in a rhythmical fashion. You're going to do 10 to 15 repetitions per set. You might feel when you first start this exercise, your neck pain might feel stiff. If you had pain down here, it might feel a little more intense at first. But if this is the right exercise for you, as you do more repetitions, your neck's going to feel looser. And if the pain was in the arm or in the shoulder blade, that might disappear altogether or become less intense. All good signs that this is the appropriate exercise for you, but try to get to your end range. Everyone's end range is different. I have decent neck mobility, so I can move pretty far this way. Others might not have that mobility. This might be their end range. They might not even need to do overpressure. If you get a positive effect from just this much motion, fine, stick to that. That's perfect. If you don't have a lot of motion, and this is it, even with overpressure, that's okay. That's your end range. That's where your magic is. That's where your pot of gold is. Go to your end range. Don't compare yourself with what I'm doing, or if you've seen other videos where people have even more motion than me, that's okay. That's their end range. This is my end range. You do your end range. That's what will work for you. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, showing you how to do cervical retraction. The dosing for cervical retraction is 10 to 15 repetitions every 2 to 3 hours or as needed for pain. So if you do the exercise and you're pain-free for 4 hours, do it every 3 hours. If you do the exercise and you're pain-free 2 hours, then do it every hour or hour and a half. Stick to the dosing that works for you, and that window of feeling better will get longer and longer and longer till you get to the point where you're maybe only doing this exercise, one set a day or maybe only 1 or 2 sets a week. Always test these exercises out. Do a set of the exercise and see how you feel. When you move your neck around, is there less pain? Is there less stiffness? If you feel like you have better motion and there's less pain, that's a very good indicator that this is the right exercise for you. If you like what you've seen in this video, subscribe to our YouTube channel, click on the little bell so that you'll be notified every time we upload a new video. Share the video with your friends, like the video, and leave comments below. Let us know if you've done this exercise and how it worked for you. Let us know if it helped you, and if so, how. And also let us know if it hasn't helped you, because that way we can suggest modifications to this exercise which might make it of more benefit to you, or we can steer you toward another exercise that will be more appropriate for you.